So I wanted to tell you a little bit of story about something that happened recently with a patient who came to visit me in my Mystic office. She was a lovely lady who sent me a packet of papers prior to her consultation with me, and it was on a disease called Derkum's disease. She brought a bunch of paperwork into me because, from what I can imagine, she has spent a lot of her life going to doctor after doctor after doctor, being written off because they didn't really know about her disease or her disease process. So she saw that I was new in my office in Mystic and that I was a plastic surgeon who did a lot of body contouring, and she decided she wanted to give it a shot with me. So I read her articles about the disease, and it was certainly interesting. It's something I didn't have a lot of experience with. But then I met her, and she was this really lovely lady, and I could see that when she came into my office, she was kind of looking at me like, are you going to be another disappointing doctor? And I could tell she was sort of pleading with me with her eyes, saying, please don't be a disappointing doctor. Listen to me. I have this disease. I know you probably don't know a whole lot about it because there are a lot of doctors who don't, and I can't find anybody in New England. That was kind of the subtext of what I was getting from this patient. And indeed, we talked for about 45 minutes, and she told me all about this disease. It was painful lipomatous collections associated with lipedema. I had some minimal experience with lipedema from residency, and what she told me, it was just very painful for her. She was a very active member of her social group. She had jobs. All of these things fell away because she was having so much pain that it eventually became a disability for her. And the worst part about it was that she went from doctor to doctor to doctor, and nobody would help her. And it wasn't because they weren't willing to help her. It was really probably because they really didn't know a whole lot about the disease. And I talked to her, and I said to her, I'm probably in that group of people who don't know a huge amount about lipedema either. But what I do know a huge amount about is liposuction, body contouring, and removing soft tissue tumors. And I said to her, I can do any of these procedures for you. I am double board certified plastic surgeon. I did an extra specialty fellowship in body contouring, in which I did countless liposuction procedures. And then in my practice, I'm kind of known for doing these very big body contouring transformations for people. So I do a lot of liposuction. But what I didn't know at the time was that there could be benefit from the standpoint of her pain syndrome associated with liposuction procedures. At the time that she left my office, I told her, I'm happy to do liposuction procedure on you. I'm looking at it from a more cosmetic standpoint because that's my perspective on things. And we kind of left it at that. She was a really nice lady. There was something about her that just made me really want to help her. But the next week, I happened to have been going away to the American Society of Plastic Surgery meeting. I was giving a few lectures at that meeting. And I happened to sit down at a table with a woman, and she was eating alone, and I hate eating alone, so I started talking to her. And turns out it was very serendipitous. She was a lawyer who was advocating for people with lipedema, and she had a booth in the exhibit hall at the American Society of Plastic Surgery meeting. So she started telling me about what she was doing there. And I remembered my patient because it was very fresh in my mind. And I said, I recently saw somebody who has Derkum's disease. Have you heard of this? And she said, of course I've heard of it. It's along the spectrum of lipedema. And we started talking about this patient. And I told her, I'd really like to help this woman. I just don't really know a huge amount about the situation. And she said, that's the first step, because so many doctors really don't know about it and aren't really particularly interested in knowing about it. But if you were interested in knowing about it, there is a panel, which is a lecture series, being put on by the researchers at Vanderbilt. It's this group of researchers that have been given an NIH grant to study lipedema. So I went to it. And what I learned was really eye-opening, and it really made me interested in learning a whole lot more about this disease. But the thing that really impressed me about the disease and about what's going on with the research is that, first of all, lipedema is very real. There is a pathophysiology to lipedema that is studyable. It is, we're able to categorize it, we're able to see histologically what's going on, and we are able to distinguish it from obesity and other things. And I think that's a point that a lot of physicians don't understand, that this is a very real disease and it can be very debilitating. And what I've learned is that it is almost exclusively found in women because it's somehow hormonally associated with estrogen fluctuations. So I see this now as a group of diseases that affect mostly women, and we have this vast array of women who are really being undertreated and underserved by the medical community because there's a lack of understanding. And although I am at the beginning of my research into lipedema itself, and believe me, I have taken a deep dive now into all of the research. I have all the book chapters, I have all the papers that have been written. I've been looking at everything being done by these researchers at Vanderbilt. I'm new to the cause of lipedema, but what I'm not new to is to liposuction and body contouring. And I think that my expertise in that area can lend toward helping people who have lipedema, because what I have come to understand is that by doing these surgical procedures and debulking the tissue, you do get symptomatic relief of the disease. While I may be new to the lipedema cause itself, what I'm not new to is the surgery of body contouring, liposuction, those things. I have a particular focus actually on large volume liposuction and body contouring. And these things are helpful in people who have lipedema. And what I've learned in the short amount of time that I have been researching lipedema is that these surgeries actually do give symptomatic relief to people who suffer from the disease. So what I would like to do, and I'm hoping to do, is pair up with people who do have that background and expertise in lipedema. I'm going to continue to research it, and I'm going to join these groups that are helping people with lipedema, and I am going to contribute my surgical skill to aid these people, you, if you're somebody who suffers from lipedema, to really help you get relief. And I'm going to do it safely. I am a board certified plastic surgeon, so that means that I'm going to keep it within the normal ranges of what's legally accessible for liposuction. I'm going to admit you to the hospital if you need to be monitored after your disease. There's nothing going to be untoward or dangerous about any kind of surgery that comes from me in my office. And I've got a team of people behind me who are there to support you. And I'm excited to be at the beginning of this journey and hope that I can become a really legitimate part of a group of people who have a real legitimate problem and are underserved in our communities.